Thank you for such a warm presentation. Good afternoon. So I've got just 10 minutes to talk about hepatitis C and HIV co-infection. For me, it's a challenge. I probably would prefer to talk for several hours here, but just to give you some information on what's happening with hepatitis C infection and hepatitis C prevention and treatment in Eastern Europe and Central Asia. What are the main issues here, and what is civil society doing right now? So just a couple of words about hepatitis, just to add to what Annette has said. Now we see that hepatitis C epidemics grows faster among people who use drugs than HIV infection. We see that even in those countries where HIV infection is under control, hepatitis C continues to spread. We know that hepatitis C increases death rates among people living with HIV. And we still notice that there's not enough attention and funding from international and national stakeholders. And my speech here is actually to draw more attention from you as country representatives to this issue. So if talking about any disease, from community perspective, from perspective of people who use drugs and other vulnerable groups, what is important? People need to have accurate and exact information on how to avoid the disease or decrease the risk of getting it, the ability to apply this knowledge in real life, because there can be a huge gap between information, you know what to do not to get HIV infection or TB, for example, but in reality you can't use this knowledge because you do not have clean syringes, for example. Also, you need to have access to testing and high-quality, affordable treatment. And both things are important, quality and affordability. And you want to be protected from discrimination. So, using this scheme, I would just talk now about where we are now with hepatitis C. So, as for information, I can't say that we are doing well. The good thing is that civil society organizations spread information about hepatitis C to drug users, but when we analyze what's written in information pamphlets, we see some drawbacks. There is some incorrect information. I wouldn't go into details right now, but my message here is that we have to improve information we're giving to people. If we already know that hepatitis C is not so much transmitted through sexual contact as HIV, people who use drugs should know it. But even more important is that harm reduction programs who distribute syringes and needles among people who use drugs usually do not distribute filters, water, and cookers. I wouldn't go into technical details here, but when people inject, they use water and they use containers where they cook solution. So you may have a clean needle and clean syringe, but if filter water is contaminated with hepatitis C, you still get hepatitis C. Unfortunately, in the region, standardized harm reduction package does not include this additional paraphernalia. Some non-governmental organizations provide this, but they do not do it on a regular basis. The other issue in the region is that access to methadone, which is referred to on this slide as OST, which is opioid substitution treatment, is very low. Less than 3% of people who use drugs get access to this treatment. And when you see statistics of who is on methadone, most of these people already have hepatitis C infection or HIV hepatitis C infection. So as for testing, now some positive news. Positive news is that the Russian Federation and Kazakhstan are providing free of charge hepatitis C testing for their citizens, but with a limitation that you need to have health insurance. If you're a drug user, do not have health insurance, you don't get tested for years. In other countries of the region, it's not accessible. Sometimes the Global Fund, through Global Fund programs, people get some hepatitis C tests. Well, the important thing here is the civil society understands that this needs to be addressed, and there were a number of civil society actions during the last year. For example, in Georgia, the result was that now people who live in Tbilisi get free of charge antibody tests for hepatitis C, and this is due to civil society action. So now a couple of words about hepatitis C treatment. So WHO recommends to treat co-infection of HIV and hepatitis C and to treat hepatitis C with pegylated interferon and ribavirin. This is a recommendation for our region, for Eastern Europe and Central Asia. Again, there is some good news that there is national funding available for hepatitis C treatment in Russia and Kazakhstan. At the same time, we can't say that access to hepatitis C treatment in Russia and Kazakhstan is universal. There are still some limitations. Just an example, in Russia, people living with HIV could get access to hepatitis C treatment, but they had to pay for all diagnostics, which is around $300. So a couple of months ago, there was a court case started by an ex-drug user who went to the court with this saying, "Hello, I can't be paying for testing, please provide it for free." He won the case, and now the situation starts to change. I would say that litigation is not a confrontation, it's not a fight between civil society and the government. It's a form of a dialogue when we can improve the current standards of healthcare. So another, do you have some more minutes? Another very good example is Georgia. We have a recent decision of the European Court on Human Rights that hepatitis C treatment has to be provided even in prison settings, and that the government has to pay for it. Well, it's a very recent decision of the European Court on Human Rights, but we think that this will help us change situation with treatment accessibility. But what is the main barrier for treatment? This is unaffordable price. To treat hepatitis C, you will need to spend around $15,000 just for one patient. It resembles of the situation with HIV treatment 10 years ago. We see now that this extremely high price can be decreased. In Georgia now, one treatment course is already $7,000. It's only for Global Fund program clients, but still. So price reduction dialogue is possible, and we think that even small pilot programs are a good argument to start this reduction of price. So just to summarize, the recommendations of civil society here would be, first of all, to include, to adapt standard harm reduction programs to hepatitis C needs, distribute filters, water containers, provide hepatitis C testing, to invest into harm reduction staff and peer counselors training on hepatitis C, and also to start pilot treatment programs and negotiate treatment price with pharmaceutical companies to be able to treat more patients with co-infections. Thank you.